Multiple sclerosis affects nearly 1 million people in the US, and it's almost 3 times more common in women than it is men. Not only that, but there's a connection that you should know about. MS affects the central nervous system, causing symptoms like mobility issues, vision changes, and fatigue. Here's what many people don't realize. MS and its treatments can weaken your immune system, significantly increasing your risk of shingles. March is MS Awareness Month, and today I'm talking to neurologist Dr. Patricia Coyle for her to share some expert information on MS. Let's go see what she has to share. Hi, Patricia. Thank you so much for being here with us today.
Hi, Gretchen. Thanks so much for having me.
As a neurologist, is treating patients with multiple sclerosis a big part of what you do?
Absolutely. MS makes up a significant portion of the patients that I treat. MS is a great success story in neurology because of the development of multiple disease-modifying therapies, so-called DMTs, in the last 30 plus years that actually decrease damage to the precious central nervous system by MS. Most of these DMTs are immunosuppressive, and therefore they carry a risk of increased infection rates.
I love hearing that MS has become a success story. So if MS and its treatments can lead to immunosuppression, what do you typically recommend for your patients undergoing treatment for MS so that they can help limit their risk of infection?
I tell my patients what the guidelines suggest. The American Academy of Neurology recommends that unless there's a specific contraindication, individuals with MS should follow local vaccine standards. In the United States, that's the Centers for Disease Control, the CDC. So receiving non-live vaccines is one of the things we always consider before starting treatment, depending on eligibility. So these can involve vaccines to COVID-19, respiratory syncytial virus or RSV, influenza. That excludes the live virus nasal mist form and shingles.
That's really good to know. And for those of you that don't know, anyone previously infected with the chickenpox virus, also known as the varicella zoster virus or VZV, can develop shingles. When you get chickenpox, VZV develops latency in your nerve cells and can later reactivate, causing shingles, which typically presents as a very painful rash that lasts 2 to 4 weeks. The risk for reactivation increases with age and in people with weakened immune systems.
Yes, that's absolutely correct.
Shingles must be so difficult for patients already undergoing treatments for MS. Is shingles more common amongst these patients who have multiple sclerosis?
Yes, and it can be incredibly difficult. Certain underlying conditions or medical histories, including MS, are associated with an increased risk of herpes zoster. A recent healthcare claims database analysis showed that overall, in adults with MS, there was a 69% increase in the incidence of herpes zoster compared with immunocompetent adults.
People with MS have so much on their plate, and it's awful to think that this could be yet another thing that they might have to deal with. Is shingles something that you see frequently in your patients with MS?
Absolutely. I specifically recall a 60-year-old female patient who had MS and got zoster and had a prolonged pain syndrome. She recovered, but this took months to treat with multiple agents, months to get it under control. She was bitterly complaining, and it significantly influenced her quality of life. It's been shown that adults with MS have higher average numbers of outpatient visits, emergency department visits, and hospitalizations at 1 month and 3 months post-infection with herpes zoster compared with individuals with MS that haven't had herpes zoster.
Wow. I mean, that's so great to consider. Can you tell me more about these complications? I am familiar with post-herpetic neuralgia, which is a nerve pain that can last for months or even years after the initial rash resolves. But what other complications can occur?
Well, certainly post-herpetic neuralgia is the big one. It occurs in 10 to 18% of individuals that have shingles. Another complication is herpes zoster ophthalmicus, or HZO, where the shingles involves the eye in 10 to 25% of cases and can actually threaten rarely with loss of vision. Other rare complications of herpes zoster include hearing loss, encephalitis, and even pneumonia.
Oh, wow. Okay. And as you mentioned earlier, the treatments for MS can increase the risk. Is that right?
Absolutely. Adults on immunosuppressive therapies can develop more severe, long-lasting rashes compared to immunocompetent patients, and they're more likely to experience complications from shingles. Some of the DMTs used to treat MS that have been associated with increased rates of herpes zoster include the anti-CD20, such as rituximab and ocrelizumab, natalizumab, alemtuzumab, oral cladribine, and the S1P receptor modulators.
Wow, this is all just so
helpful and things that we should be considering. As we know, shingles can affect any person's quality of life, but getting shingles and possibly a complication on top of that while also battling MS just seems unimaginable. Is there anything that you recommend for your patients with MS for preventing shingles?
Preventing reactivation of the herpes zoster virus is the only well-documented means of preventing shingles and its potential complications. And the CDC recommends herpes zoster vaccination for the prevention of herpes zoster and related complications in immunocompetent adults aged 50 years and older, and in adults aged 19 years and older who are or will be immunodeficient or immunosuppressed because of their disease or their therapy.
As a physical therapist, I feel like this topic is not talked about frequently enough, yet it can really impact people's lives with MS. So, Patricia, thank you so much for being here with me today and for educating us on this topic.
You are very welcome. Thanks so much for having me.